Welcome to the Medicare Rights Center's series, What's at Stake, where we're reviewing potential changes to public health programs to help you better understand what's at stake for older adults and people with disabilities in the health policy landscape. As we said in the companion to this video, policy ideas often gain and lose popularity over time, and this is especially true for policies related to the major healthcare programs of Medicare, Medicaid, and the Affordable Care Act. These ideas aren't always partisan, and they often emerge in debates around healthcare reform. In the companion video of this series, we discussed threats to Medicare. In this part, we'll explore potential changes to Medicaid and the Affordable Care Act. Some of the threats to Medicaid and the Affordable Care Act we'll cover have already been partially enacted through the 2025 Budget Reconciliation Bill H.R. 1 and other changes. But more damage could still be done. As policymakers plan for the future, now is the time to understand what's underway and what's at stake. We'll start with Medicaid-related policy ideas before giving an overview of the ACA's protections and the threats they're facing. Problems with changes to Medicaid financing. Medicaid is financed and administered through a federal-state partnership. There is no preset limit to the funds the federal government provides through the statutory formula. So when state spending increases, so does federal spending. The program is often targeted for cuts. 2025's new budget law, H.R. 1, cut federal support for Medicaid, leaving states scrambling to cover the costs or to cut benefits. If lawmakers seek additional cuts, some restructuring proposals from past years are likely to resurface, including reducing funding by changing Medicaid to a block grant or providing funds on a per-person basis. A block grant would be a fixed amount of federal money that goes to the states. To save federal dollars, the allocations under most proposals would be inadequate to cover current costs. They would also fail to automatically adjust when circumstances change, like higher enrollment or rising costs, shifting more costs and risks to states over time. States would have to pick up the remainder, or cut what they cannot afford. Per-person caps would similarly aim to save federal dollars. Unlike block grants, they would adjust if enrollment went up. But like block grants, these caps would leave states without help if Medicaid costs rose due to unexpected events like an economic downturn, another pandemic, natural disasters, or introductions of new, expensive therapies. Older adults and people with disabilities account for over half of Medicaid spending, despite making up less than a quarter of the Medicaid population. They'd likely be hit hardest by these financial restructuring proposals and ensuing cuts to programs. Problems with Medicaid waivers. Section 1115 demonstration waivers give states flexibilities to test new approaches to Medicaid that deviate from the standard coverage and benefits that federal law requires. In theory, they're meant to give states a chance to improve how they provide health care to low-income individuals, but at times, the Centers for Medicare and Medicaid Services, the federal agency that oversees Medicaid, has approved waivers that appear to contradict this purpose. This includes waivers that would impose work requirements beyond those in H.R. 1, higher cost sharing, and lockout periods that delay re-enrollment. Starting in 2027, H.R. 1 is shortening federal retroactive coverage requirements from 3 months to 1 month for people with expansion Medicaid and to 2 months for other enrollees. But some states have already used waivers to reduce or eliminate this coverage, and other states may follow suit. Other waivers would eliminate vital non-emergency transportation services. Problems with H.R. 1's Medicaid cuts. H.R. 1 makes other damaging changes to Medicaid that will harm older adults and people with disabilities. This includes limiting who is eligible by restricting coverage for immigrants who are lawfully present and making care harder to access for those who still qualify through burdensome new rules. H.R. 1 imposes new administrative barriers alongside its harmful work requirements and prohibits enforcement of rules meant to streamline enrollment into Medicare savings programs that help people afford Medicare coverage and care. As we've mentioned, federal Medicaid funding cuts will leave states stretched thin. Many are likely to respond by cutting benefits that are not federally required but are absolutely necessary to the people who rely on them, such as home and community-based services. Providers in rural areas, whose funding disproportionately relies on Medicaid dollars, are at risk of closure, which would deprive rural communities of care. Threats to Affordable Care Act protections. In addition to Medicaid, the Affordable Care Act and its protections for consumers are also at risk. The ACA allows states to expand Medicaid to cover adults aged 19 to 64, with incomes up to 138% of the federal poverty level, regardless of dependent status. And to date, 41 states, including D.C., have done so. It makes most private insurance coverage more robust. For example, it limits age-based discrimination, protects coverage for those with pre-existing conditions, and requires participating plans to provide a range of essential health benefits and preventive services. It also eliminates annual and lifetime limits, which would otherwise expose the sickest and most medically in need individuals to extreme costs. However, there are threats to the ACA's successes, some of which are already underway. This includes H.R. 1's work and reporting requirements in expansion Medicaid, new or yet-to-be-enacted administrative barriers to marketplace plan enrollment, and the expiration of the premium tax credits that made plans affordable for many. There's a lot at stake for older adults and people with disabilities. We hope you'll reflect on these policies and read the in-depth analyses available on www.medicarerights.org/policy.